Good day, everyone. Greetings from Kiev, Ukraine. I'm honored to participate in such significant congress. Before I proceed with my today's presentation, I would like to shortly introduce myself. I am MD, blood banking and transfusion medicine specialist in the biggest children's hospital Ohmedit in Ukraine. There is now a war in my country due to the attack of the aggressor country of the Russian Federation. Okay, firstly, I want to talk with you about massive bleeding in pediatric, next mass transfusion, and next the case of massive hemorrhage and transfusion in the neurosurgery operation room. Massive bleeding in pediatric. The main causes of massive bleeding in pediatric practice are trauma and surgery. Massive bleeding is defined as a loss of more than one blood volume within 24 hours in adults and the loss of more than 20% blood loss in less than an hour in pediatric. Children are not small adults. They have unique needs, especially when they are injured. First, estimated critical blood volume in accordance with the age of the patient, maturation of hemostasis, but functional assessment of global hemostasis does not differ significantly across pediatric age group and compare with adults. The Department of Defense Trauma Registry was acquired from 2001 to 2013 for pediatric trauma patients in Iraq and Afghanistan. Results. The Department of Defense Trauma Registry yielded 5,000 combat-injured pediatric trauma patients. Conclusion. Based on this large cohort of transfusion combat injured pediatric patients, the threshold of 40 milliliters per kilogram of all blood products given at any time in the first 24 hours reliably identifies critically injured children and high risk of early and in-hospital death. As a result of the full-scale armed aggressor of the Russian Federation in Ukraine, 1,353 children were injured, of which 456 children died due to serious injuries. Mass transfusion usually is defined as the transfusion of more than 10 units of packed red blood cells within 24 hours. Many pediatric mass transfusion definitions are based on the volume of blood products transfusion as a function of the estimated total blood volume for the children over at 4 hours, 12 hours, or 24 hours period. A mass transfusion protocol is not only the ratio provision of blood components. There are 7 critical process elements associated with mass transfusion protocol, known as the 7 T's: trigger, team, tranexamic acid, testing, transfusion, temperature, and termination. Mass transfusion protocol is activated based on criteria specific for the pediatric patient. Early notification and preparation of the extended team. Consider tranexamic acid 15 mg per kilogram infused over 15 minutes, followed by 2 mg per kilogram infusion for at least 8 hours or unit bleeding stops. Specimen testing is vital to assess the critical status of the patient and ensure appropriate patient care and blood transfusion needs are met. Blood products are provided based on the patient's weight in a standardized manner. The aim of transfusion is to maintain a minimum laboratory transfusion thresholds. It is critical to keep the patient's core temperature greater than 36 degrees Celsius. The core transfusion must be terminated when the emergency need for blood products has ended. This will allow for the resuming of routine testing and products preparing in the blood bank. Case. The 4-month-old male patient. Diagnosis: neoplasm of uncertain behavior of cranial nerves above the cerebral tent. MRI shows a massive cystic salt volumetric formation of the brain's left hemisphere at the time of the examination without signs of impaired blood circulation and signs of an internal hydrocephalus with a mass effect of the right, hypoplasia of the left vertebral artery. Massive blood transfusion protocol was activated during this operation. We follow these laboratory transfusion thresholds for gold directing blood therapy. The results return after surgery. Diagnosis: benign neoplasm, brain supratentorial above the cerebellar tentorium, volumetric formation of the left lateral ventricular movement, discovered syndrome, delay stop motor, and psychodevelopment. Symptomatic epilepsy in the follow-up of focal attack drug induced. The patient after the recovery period after surgery is directed to further treatment. Red cells and platelets are irradiated to prevent transfusion-associated graft versus host disease in pediatric practice. Anti-CMV negative red cells and platelets are not needs at all. Cellular blood products in our blood services center are pre-storage leukoreduces and CMV safe. Thank you for your attention.